And now I'm really pleased to hand over to our speaker for today, Dr. Thomas Kabir from the McPin Foundation. Thanks, Thomas.
Good afternoon. Thank you very much for having me and for inviting me to give this talk. Yeah, my name's Thomas. I am Head of Public Involvement at a mental health research charity based in London, although we work across the country, including in Oxford. I'm going to give a talk today about research papers, about finding papers and how to read a research paper. I've got some slides. I'm just going to go over to a web browser to show you a database called Pubmed. Hopefully my talk won't be more than about 40 minutes long, but I'll be very pleased to answer any questions that I've got. So I'm just going to share my screen. So can you see the title slide? Is that okay? Great. Well, sorry, I'm just going to go down to the next slide. We live in a time when it's pretty important to have faith in medical research, I'll say, particularly at the moment when a vaccine has just been released and approved by the MHRA for COVID-19, and we have many more on the way. We need to be able to weigh up evidence for ourselves and to be able to confront and expose lies and disinformation. We live in a time where, certainly in the UK, most of us have access to more information than we've ever had before. But terms such as fake news, disinformation, lies are absolutely everywhere. And you don't need to go very far to find them. I got this leaflet through my front door a few days ago. It's entitled COVID-19, an evidence-based analysis. It contains all sorts of lies and disinformation about the current pandemic. It's quite disturbing, really. And I've just put some newspaper headlines there. One is from the Evening Standard, quoting the president of the Red Cross, saying we're facing a second pandemic of false information, which may impact on people's willingness to be able to be vaccinated against COVID-19. There was the case of hydroxychloroquine, which was another drug which was considered as possibly being something that could help with COVID-19. And yet the US Congress was tied up in knots about talking about it because of the way that it was presented elsewhere within the US. And if you need to have some help having a baby, if you need some help from fertility services and you need in vitro fertilization, IVF, the chances are, unfortunately, that you're having to pay for it yourself. The majority of the provision for IVF is in the private sector, and they offer, just as the NHS does, all sorts of what we call add-ons. Those are procedures in addition to standard IVF. Many of them are not evidence-based. Some of them are fine, some of them have strong evidence, and they may very well help. Others do not, and they do not have good evidence behind them. But yet clinics up and down the country offer them, and they cost hundreds, if not thousands of pounds, and they can put couples in quite a difficult situation because you're sitting there thinking, well, if I didn't try this one thing, that might make a difference between me having a baby or not. It's very, very controversial. There is an investigation going on about the way that these add-ons are being marketed at the moment. The point I'm trying to make is that reading a paper and evidence may very well make a difference to what you actually do. It's the way that you live your life, and especially during the current time when a vaccine is just about to be rolled out throughout the country. So in this talk, I'm going to cover a few things. I'm just going to give a little introduction, a little background to research papers and journals. I'm going to cover how to find a research paper, including how to access a research paper, because that's quite an issue. And I'm going to give you some of the ideas that I use to read a research paper. What I'm not really so much going to do, although I do give a couple of ideas, is how to assess the quality of a paper. That's something else. That's something about looking at the quality of the science, the research behind the paper. And I thoroughly believe that just a little knowledge and experience can get you quite a long way. I very much speak from personal experience here. In my role at McPin and elsewhere, I have to have a sort of working knowledge about all sorts of things that, frankly, I know nothing about. I've been in a situation where I've had to look at a study about a new procedure to remove wisdom teeth. then half an hour later it's a new stem cell treatment, and then half an hour after that it's a new pacemaker. Not talking about something that I know very little about is something that actually has been the backbone of a lot of my working life for quite some time. It's not easy, it's hard, and I fully acknowledge that. Having said that, I do believe that just a little can get you quite a long way, and that most people can get something out of reading a research paper. But I do acknowledge that there are other factors such as lack of internet access, might be people who have certain disabilities that can present additional barriers. So a little bit about research papers and journals. I thought it was useful to talk about, well, what is a research paper? Well, it's an article in a scientific magazine. Another name for science magazine, I say, is a journal. There are thousands of them. In the distant past, papers were literally letters. The names of some of these journals reflect this history. Sometimes scientists would write letters to each other or would write letters to the editor, to someone who would put a journal together. There were many instances hundreds of years ago of people making discoveries at round about the same time. And then there was a huge controversy about who discovered what. And publishing, putting it out there, putting it in public was one way which made all of this much more straightforward. One of the oldest journals in the English-speaking world is the Philosophical Transactions of the Royal Society. It was first published in 1665. Coincidentally, that was the year that plague was spreading up and down the country. Isaac Newton was forced to leave Cambridge University, where he was professor at the time, and he had to work from home, from his family home in Lancashire, I believe it was. And when he was working at home, he made some of the most famous discoveries in science. Something about working from home from a few hundred years ago that perhaps we can bear in mind for today. And I do think it's important to bear in mind that papers are very much written and aimed for a specialist audience. They are not aimed at the public, generally speaking. They're aimed at people, I would say, who have quite a high level of knowledge about the way that papers are written and about the subject that's being discussed. And I think it's important to bear that in mind. And just like magazines or newspapers, journals are of various quality or standing. There are various methods which have been used. Some of them are called impact factors, some of them are citation indexes to try and rank journals. They're very, very controversial. And what I've done there on that page is that I've just put a few logos of some very well-known medical journals. Every single field, including mental health, has its own set of journals. Such in my field, in mental health, it's things like the Lancet Psychiatry, the British Journal of Psychiatry. Every single specialty and subspecialty has its own set of journals. And I do want to point out that just because you may have heard of some of these journals, they may be high quality, doesn't mean that all the articles that are published in them are necessarily of high quality. And up to quite recently, you had to have access to an academic library to get hold of a paper. Access has always been an issue. And even if you do have access to a library, it might still not have had that journal that you need. And even then, I remember when I was at university at UCL, University College London, I remember looking and looking and looking, and I finally found the journal that I was looking for. And someone had ripped out the journal article that I wanted. And I'm sure that there were librarians up and down the country who give you all sorts of horror stories about the way that journals were mutilated. But access has always been an issue, but I think it's getting a bit better. And I'll later in my talk, I'll say a little bit about why. I just put a little infographic there about the number of papers being published in different countries. In this infographic, this was from 2018. It's important to note that quantity doesn't mean quality. So even though a country doesn't publish that many papers compared to other countries, it doesn't mean that it's of any lower quality. There are tens of thousands of journals across the world publishing millions of papers a year. I couldn't get an accurate answer as to how many journals there actually are, but it's certainly in the tens of thousands. There are journals for everything, including a lot of things that you never knew existed. And just like any other piece of literature, say a book, for example, some papers are well written and structured, and others are very badly written and almost designed for people not to be able to understand them. And journals are exceedingly expensive. There have been cases of entire countries, I think Germany almost lost access to hundreds of journals because of disagreements at a national level over pricing issues. It used to be that journals were predominantly published by academic societies. More and more what you're seeing is commercial for-profit companies actually publishing journals, and the prices become very, very expensive. So I just want to cover just for a moment, well, how do you find a research paper? And that's assuming that you do not have the reference for a paper. These are some useful tools that I use. The most useful thing that I find is Google, to be honest. If I'm looking for something, Google is often the first way that I will go. And there's a database of 30 million, I think it is at the moment, research papers called Pubmed, the Public Library of Medicine, run by the United States government. That's the one I'm going to show you today. And Google has its own specialist search engine called Google Scholar. Another tool which I use is the Control F. That's the finding page. That is so helpful. So instead of having to go through pages and pages of things, if you're looking for the conclusion section, for example, Control F conclusions, or Control F for an author that you might be looking for. It's very, very helpful. So PubMed. If you're looking for a journal, aside from Google, I would say very much PubMed is the place to go. It's freely accessible. I put the web link down there. And the reason why I'm suggesting you look at PubMed is because that's the database which gives you the most links to the actual full text where it's freely available for the paper. If there is the free text for the paper which is available, you're most likely to be able to find it through PubMed. And PubMed has some absolutely fantastic online training. Please, I beg you, please do have a look. I'm very happy for my slides to be shared. I put the web links in there just below. It has a really great suite of online training, including a video, various tutorials. It's all there. And we're going to have a look in a moment at PubMed to try and actually find a paper. So one way of finding a paper, if you look at a news article, let's take the example of dexamethasone. That was a drug which was discovered to have a good effect to help hospitalize people with COVID-19, with coronavirus. And this is the BBC News article back from July, I think it was. I've put the web link down there below. And as it happens, in this article, if you just look around the various hyperlinks, this article is hyperlinked, you'll find a link to the actual paper in the article. And I'm seeing this more and more, that if you are looking at an article from a major news organization, such as The Guardian, such as The Times, such as BBC News or Sky News, they'll actually put the link to a paper in the article itself. And I think this is also a move towards transparency, towards allowing the public to be able to check things out for themselves so they can make their own decisions, to try and debunk and try and combat some of these conspiracy theories that I alluded to earlier. So actually, in this example, finding the paper behind the headline is actually very easy. There's a link there. And the link takes you straight to the paper. There it is. I do want to have a note here that this is what we call a preprint version of a paper, meaning that it's a draft version of the paper. It's pretty close to the final version that will appear, but it may not have been what we call peer reviewed. So it may not have been reviewed by other scientists. So the final version may be slightly different. Let's look at another example. So I saw this article from 2018. This is with a researcher called Professor Daniel Freeman, who I work with. I'm very lucky to be involved in a few research studies in Oxford. And the title of the study is Virtual Reality Cured My Fear of Heights. And there's just a little section of the text there. Now I do have to say here that I'm cheating a little bit. The full text of the paper was actually in that article, but we're gonna pretend that it doesn't. And it's naming a lead researcher there. Lead researcher, Professor Daniel Freeman. So what we want to do is to be able to find the paper, find the original research paper, and we're just going to pretend for the sake of argument that it's not there. So let's go back to Pubmed. So I'm just going to try and share my screen. So there we go. So the question is, what do we put in the search box? And I'm going to give you a formula that I use. No one taught me this. This is something that I just came up with through my experience. So my formula is condition, intervention, a name of the research team if you know it, and the year. So the newspaper article says it's aiming at fear of heights. So I'm just going to put in fear of heights. The intervention, so it could be a drug, for example, so breast cancer drug, Herceptin, for example. In this case, we know it's virtual reality, it's VR. We know that there is an author named in the article, and very often in articles reporting on research, you will find the name of a researcher. It could be the lead researcher, it could be anyone. But if you find a name, put it into this box. So I'm going to put in Freeman, and you always put in the surname. That's the one which really identifies the author. And then the name. So the article was from 2018. So we're just going to put that in, press return, and we get an article. So this time it's taking us straight to one article. Often you find more and you have to do a little bit of sifting. This time it's taking us through one. So we're just going to check it through. So it's 2018, so that's the right year. We have Daniel Freeman there. Automated psychological therapy using immersive virtual reality for treatment of fear of heights, single blind, parallel group, randomized control trial. It sounds about right. What I do want to point out to you as well is look over here, and this is the magic of Pubmed. You have access to the full text, and we'll go there in a moment. If the full text to a paper is available, it tends to be here, and you can use either of those links. Now, Pubmed is much, much more helpful than I'm making it sound. Down here, you can search for similar articles. You can look for the references to other papers that this paper mentions. You can look for other information about this paper and so on. And there's all the figures and so on down there. So let's just go and try and get the full paper. There we go, just coming up. So there's some similar articles there. You can search by publication date. You can look for a certain kind of research, whether it be a randomized controlled trial, something called a systematic review, which is trying to put lots of different pieces of evidence together. It really is very, very helpful. And of course, I've shown you quite a simple example. I'm not pretending that it's easy. I know it's difficult, but I do believe that Pubmed does work. So I'm just going to switch back to my slides. So again, what do you put in the search box? I suggest condition, intervention, a name of a research team if there is one. If it's a news article, generally speaking, there will be the name of someone from the research team in it, and then the year. That just shows the page that we've just had, and then there's the link to the full text on the left. And this is the old-fashioned way of finding a reference. That's the way of referring to a paper. If it's a book, it would just be the title, the author, the publisher, and then the date, or something like that. Many journals are still, of course, published in print. And when you see a reference in a journal to another paper, this is generally what it will look like. You'll have some combination of authors, journal name. It's often an abbreviated title, by the way. So you have to Google the abbreviation to find the full title. But trust me, Google it, 9 times out of 10, in the top 2 results, you'll find the full name of the journal. The year of publication, volume number, sometimes you have the issue number, the magazine number, and the page numbers. It will usually be some sort of combination of this. There are lots of different reference formats, but this is the general one that you'll find. And you can just put those terms into Pubmed, or if you Google the journal name in, it can take you to the website of the journal, and you can put in volume number, page number, year, and it will take you straight to that article. Papers usually do now have a special permanent web link that includes something called a DOI number. So you'll see these funny web links everywhere in papers with DOI in them. That's digital, that stands for Digital Object Identifier, DOI number. What that is a permanent web link. So some journals are now published entirely online. They're not published in print. There are no page numbers. And what that is a permanent web link for the paper. And you can use that DOI number, to search for the paper. Someone online described it as like a national insurance number for papers. It uniquely identifies a paper. That's the whole point. So if you found the paper, well, how do you get hold of it if the full text of the article is not available via Pubmed? There's something called preprint servers. So there's more and more websites which are called preprint servers, where the drafts of papers before they are finalized for publication can be found. And this is one of the biggest preprint servers for medical research. I've just put that up there. It's called MedR. I'm not sure exactly how to pronounce it. Medical Research Archive, I think it is. I could be wrong. And there are preprint servers for almost every discipline. Some of the oldest preprint servers were actually for particle physics, people at CERN, the particle accelerator. That's where the idea of the internet was really founded. They have one of the oldest preprint servers for particle physics research. It has a very long history within academia. And they're freely available, sorry, I forgot to mention. This is not a great option at the moment during the current pandemic, but it can be library access. In London, you can join the British Library, you can get papers sent to you electronically. I think there is a fee for that though. And the Wellcome Collection Library in Euston allows a certain degree of off-site access if you become a member, and you can become a member there for free, although they're closed until January the 5th, I believe. And you may find that your local university library can give you some level of access as well. So I believe that the Bodleian Library in Oxford may be able to give you some degree of access. Another option, of course, is to email your local PPI contributor, who I'm sure will be happy to send you a copy of the paper if they can get access. One of the issues for us at McPin is because we're in an independent research charity, we don't have access necessarily to academic libraries. So this is something that very much affects us as members of staff. There are more and more open access articles and journals. So most major UK research funders, including the National Institute of Health Research and the Wellcome Trust, now insist that research that they fund are published in what we call an open access journal. What we mean by open access is free. Anyone can access them. There are different funding models for this, but from the point of view of a user, it just means it's completely free. Sometimes entire journals are what we call open access journals. In other cases, only individual papers will be open access in inverted commas. And you can look for that open access symbol there. It's kind of like an unlocked padlock. So you can look for that when you look at papers. But in other cases, it will just simply say free or open access, but that's what it means. There are other options. There is a website called ResearchGate, which you can sign up to, and that is almost like a paper swapping website where you can swap copies of paper. You can request the full text of copies of papers. And research papers usually have a lead or what they call corresponding author. Remember, I alluded to letters, the idea of letters, correspondence. That's where it comes from. And you can email them, and their email addresses are usually displayed publicly, even if the full text of the article is not. And you can email them to ask for a copy of the paper, or indeed if you have any questions about the research at all. So that's one option. I would say, well, do you actually need to look at individual research papers? You know, do ask yourself the question. I don't want to be a hypocrite, but it may be that for your purposes, you don't actually need to. You may find that someone has actually done the work for you. So for example, the Cochrane collaboration, they produce things called systematic reviews, where they look at evidence from different papers around any given topic and produce a summary, basically, using a very, very rigorous method. They're very well respected. So you might be looking at the effectiveness of a particular drug for breast cancer, for example. Well, they're more likely than not, they'll have what we call a systematic review, which is freely available on their website. As another example I alluded to earlier, fertility, the government regulator, the Human Fertilization and Embryology Agency, have a traffic light system for these IVF add-ons, which I described earlier. So they have a red for if there's very sketchy or very little evidence, an amber where we're sort of not quite sure for a given intervention, or green where there's pretty strong evidence. And that's publicly available, and they're very much trying to get patients who are having fertility treatment to, you know, go onto their website and have a look before they agree to hand over hundreds or thousands of pounds for these extra add-ons. And other countries are actually looking at the same model as well. It's proved to be really quite helpful and quite popular. The point that I'm trying to get to is that you may not always need to actually look at research papers. You may find that something else may be helpful as well. So I'm just going to go to my next slide. So how is a paper structured? Well, there are papers and there are papers. I'm showing you one particular kind of paper. The one I just showed you earlier was about an intervention, about a VR intervention for people who had fear of heights. And the typical structure of a paper like that will be something like this. There'll be a title of the paper, which I think is rather overlooked, actually. I'll say a little bit more about that in a moment. There's an abstract or a short summary of the paper. There's an introduction. There's a method, so what actually happened, what people did. There are the results. There's a discussion, sometimes it's called conclusions, and there's references. So those are other papers which are mentioned within that paper. There are different formats, but that's a very popular one. There are other sections within the paper I'd advise you to look at. Are there any conflicts of interest? Do bear in mind if there are any stated conflicts of interest amongst the people who have written the paper. So if the author of a paper, for example, has a major financial interest, let's say he or she has an interest in a company which makes pacemakers, and the paper is about the effectiveness of that pacemaker, you do just have to bear that in mind. I'm not saying conflicts of interest are bad. Most university departments, if not all, will have policies about how to deal with conflicts of interest, but you do just have to bear that in mind, and they're usually declared in a section within a research paper. And do also check where the funding for a study is coming from. And sometimes you can find this in what we call the acknowledgement section. I just want to use an example. You're going to think I'm obsessed with fertility, but if there's a paper about a dietary supplement, which is meant to improve your fertility, you might be more cautious if you found out that the paper was actually wholly funded by the manufacturer of that supplement. I'm just using a crass example to try and sort of bring out some of the more obvious issues. So how do you read a research paper? And I'm just going to sort of describe the way that I do it. And I've not been given any training whatsoever in how to actually read a research paper. I was just given a paper and said, read it. And this is kind of what works for me. There are many other methods. I don't try to read a paper from start to finish. I don't think most papers are meant to be read in that way. I don't try it. I try to give it a skim. I'm trying to get a sense of what the paper is about. I don't ignore the title of the paper. Many people just go to the abstract, the summary of the paper, and they concentrate on that. I'm trying to work out fundamentally what questions that the paper is trying to answer and what the paper is generally about. I highlight any punchlines or sections of text which then seem to be answering those questions. And these might be found in the conclusions, but it might be found in other sections of the paper as well. And then finally, I tried to look at the methods section of the paper and try and work out if the methods and the sample size, that's the number of people who took part in the study, sound reasonable. So generally what I'm trying to do is, what is the paper about? What's the headline title? Are there any conclusions or findings I can pick out? And then I try to work back to, well, do I think that they've, this paper makes sense? Do I think that they've included enough people? Do I think they've used the appropriate methods? Do I think that they've done the research in the right way to answer those questions that I spoke about earlier? I usually have to read a paper several times. I work with people who somehow just read stuff and it just goes in just like that. I am not one of those people, and I'd encourage everyone to have a great deal of self-compassion here. It's not easy. It certainly doesn't come easily to me. I have to read something 3, 4, 5 times. And depending on what kind of paper it is, I may only understand a fraction of what's in it. So going back to Daniel Freeman's paper here, I've just put in excerpts here and what I've highlighted. I've looked at the title. I don't understand what single blind means, so I've just highlighted that, or parallel group. I need to look at that. That's actually explained later on in the paper. There's a section called findings. That's very helpful. There, 100 individuals were enrolled. Roughly half received VR, it seems, and half received the control group. And I'll have to read more to find out what that control group is. And there, under a section called interpretation, there is what I referred to earlier as a punchline. Psychological therapy delivered automatically by a VR coach can produce large clinical benefits. That's what I call a punchline. And I'll do this again and again and again to answer those questions. I also put a list of what I think are the good points or the strengths of the paper, together with a set of what I would call the bad points or the weaknesses. And I'll try to weigh up one against the other. Now, for every single area of research or field, you'll find that it has its own unique set of jargon, of acronyms. Mental health is the field I know most about, and you'll find all sorts of things like QLL, quality of life. You'll find PANS, which is a questionnaire for looking at symptoms of schizophrenia, for example. And I try to build up a kind of vocabulary for anything that I'm looking at. The acronyms are usually explained within the paper, but I find having a sort of jargon buster is very, very helpful, and I build my own one up. It is a lot of work. It does take me several times, but I do think that with a great deal of patience with yourself, most of the time you can get something out of a research paper. I Google any terms that I don't understand. Remember, Google is my friend. Google is what I use the most, apart from Pubmed. And this covering what I just said, I try to build up a vocabulary of research terms, and I write a list of what I think are the strong and weak points of the paper. Also nowadays, if you look on Twitter, you'll often find out that someone else has reviewed or commented on the paper. I'll speak about that a bit more, so you might find someone else's review of a paper. You will typically find at some point in a paper a whole block of quite intimidating text about statistics. They might have things such as p-values, P, confidence interval CI, standard deviation SD. I'm a firm believer that actually, and I'm sure that some statisticians may be on this, who are attending this talk, maybe tell me otherwise, that you can get quite a long way with quite a superficial understanding of what these things mean. So a p-value is just the chances that something may have happened by random. And many researchers use the number 0.05 as the level for significance. Anything 0.05 or below is significant. Anything above, be more cautious. And that's one area where I'd say actually just knowing the number, knowing whether it's below that number or above that number can get you quite a long way. A standard deviation is a sort of, gives a sort of idea of how spread out your data is. There's a great guide, which is produced by an organization called Sense About Science, called Making Sense of Statistics. It's freely available, and it really does give clear, plain English explanations about many of the statistical terms that you'll see in research papers. I beg you also, secondly, to have a look at that. Over the last 10 to 15 years, we've seen a growing body of literature about papers, blogs about papers. In the mental health sector, there's an organization called Menoversion that produce the mental health. And that's a group of, that's a website which essentially reviews research papers. Mental health in this case, I've put the web link down there. So you'll find reviews about research papers. And as a training exercise, it's very good to look at these reviews, look at the original paper, and see what these reviewers are picking up on. That is a very good training exercise to get you attuned to the sorts of things that you need to look out for, because it's very, very hard to know what you don't know, if you see what I mean. Looking at someone else's review, looking at the original paper and matching them and doing it again and again and again is a very, very good training exercise. And the BMJ, the British Medical Journal, also have a series of blogs. So there's a whole literature about papers, which you might find is helpful. There are some great jargon busters out there. Google is the ultimate jargon buster, but there are ones which are more specific to research. I've just put a link down there. There's one to the Involved Jargon Buster and one which is produced by the Cambridge BRC. They have a particularly good definition of p-values, by the way. And there is some great online training called Publons, which is a free peer-reviewed training course. And that will help you. It's aimed at helping to peer review a research paper. So that will get you attuned to the sorts of quality issues. So not just is it a good paper, but well, is it good science? And of course, there's the Oxford BRC events, and I've just put the link down there. So I'll say at this point, thank you so much for listening. I am here for questions, despite what's on the slide, but if you do want to email me, my email address is there, and my Twitter handle is @ThomasKabir. So thank you so much for listening, and I will stop sharing my screen there.
Thomas, thank you so much. That was such a brilliant, clear and really helpful step-by-step guide of how to do things. Thank you for taking your time to do that. I'm going to selfishly take advantage of my privilege of host and ask you a quick question. I wondered, you said this is all, you've had no training. So are you entirely self-taught in how you've learned to do this? It's just through trial and error and having to read lots of papers that you've learned these techniques?
Well, kind of, yes. I started out life as a physicist. Well, I wasn't born a physicist, but I went to university and I did my undergraduate degree in physics at UCL. And I changed fields completely to bioinformatics for my PhD. Now, because of that, I knew almost no biology. I knew very, very little about proteins, except they're big wobbly, whirly, swirly things which made pretty pictures. I'm serious, that's the level of my knowledge. I don't know how they accepted me for a PhD place there, but they did. And so I was thrown into a whole literature that I knew nothing about. Now, physics papers were in a different category. They were extremely dense. I had some idea of what they were about, but I never really looked at any kind of scientific paper until I got to my PhD. And that's when I had to learn for myself. And that's where I had to learn very quickly. So no, I didn't receive any training whatsoever. I had to do it myself, and I was on a very, very steep learning curve. And that's really where I got this learning from, which was when I was in my first year of my PhD at UCL, trying to get to grips with a huge emerging new field.
Well, so thank you for sharing that. And that's really encouraging for all of us, that you, with a bit of perseverance, we can all be understanding things which we may think are a bit scientifically beyond us. And we've had a few questions in the chat, and one which I think is really interesting is, does a peer-reviewed journal offer any guarantee that you can be confident in the quality of the research that's published in it?
Absolutely not. So there are cases all the time of papers being retracted, that's being withdrawn. I took part in a petition with a very prominent person within the university, for example, to retract a paper which made all sorts of claims based on people's race, for example, or we've got no idea how it was published. So you can find a lot of junk in journals as well. That being said, for some of the major journals, the peer review process, and this is quite controversial, I would say, is fairly reliable. Just like any kind of literature, you'll find good books, you'll find bad books. The quality is another issue. I would say for a well-respected journal, which is read quite widely, you are on safer ground. Having said that, there are some very specialist journals where people have no choice but to publish in that journal because that's the only journal for that particular field. So just because something is widely read doesn't necessarily mean that it's high quality or low quality and vice versa, of course. So no, I don't think there's any cast iron guarantee there.
No. And actually, just having a look at the chat, we've got the comment that Andrew Wakeful and the MMR vaccination is a good example of something which turned out to be very poor quality, but in a notable journal.
Absolutely. And this is one of the reasons why I'm so keen for people to be able to have direct access themselves. They can make up their own minds. They can have a look, they can critique critically and make up their own minds as to whether what they're being told is good.
There's been a bit of a discussion, I don't know if you'd like to add anything to this, about the balance of evidence-based medicine versus real-world evidence, which has become more popular recently and is more accessible. And I'm just, excuse me while I just catch up on the chat about this. But we're looking at real-world evidence can be used for value-based decisions, whereas EBM emphasises the practical application of the findings in current evidence. I don't know if you have anything to suggest there. I think real-world evidence was being suggested as a way of putting forward evidence-based medicine in a more public-friendly way.
Well, I'm not actually, if I go back to fertility, what will happen in the clinic is that people will say, doctors will say, well, in our experience, this may help you. So what I would say is use your common sense, use all the information that's in front of you, use your senses and come up with a considered decision for yourself. And it may be that some groups of people are only providing with some evidence, but not all the evidence that you need. But I'll say have all of the evidence that you need together and then make a decision about what you're going to do. I don't know if that helps. It sounds like quite a sort of crass answer.
Not at all, not at all.
But I think, I mean, I'm trained in, I was trained in science. So I do put stock in reading research papers, otherwise I wouldn't be so enthusiastic about it. So I think have access to all the evidence that you need. That's the main point that I would make, and make a decision for yourself, and also be open to a range of different opinions. So I would never say just read a paper and base a major life decision on that. No, talk about it, discuss it, ask questions about it, and then after doing that, reach a decision. I used to be a mental health advocate, and I used to get very annoyed at when I used to come with my clients to appointments and they were expected to make quite big decisions about a medication or so on the spot. So I do say also push back. Try and allow yourself to have the time that you need, or fight for the time that you need. That's the other thing. I don't think I've answered the question, but anyway, those are my thoughts.
It wasn't very, I didn't word it very well, so it's fine. I'm going to come to some other things you said. We've had a comment about the need, and I'm sure you'll agree with this, the need for there to be more plain language summaries of research papers that bring out the key points from the full paper. And I'm sure you'd endorse that, wouldn't you?
I fully agree. I think it should be a condition of funding, not just that research is published in an open access journal, but there should be a plain lay summary of the research findings. There should be podcasts, there should be videos, There should be infographics, graphical kind of summaries. There should be a range of formats which are accessible to people from a range of backgrounds and disabilities. I utterly agree. And I think it should be a condition of funding as well as open access personally. That's just my opinion.
Yeah, thank you. And that's, again, I'm just going through the chats, that's echoed by a few people. There's an interesting question, I'd be interested to hear your thing. And the comment, people knock Wikipedia, but it's peer reviewed almost constantly, which stops attempts to post fake news after as little as 15 minutes. Therefore, would you say that that is a good source of knowledge?
I don't want to give a straight yes answer to it, but I think it's one of the go-tos. So Wikipedia would be one of my go-to sources of information. So my general philosophy is that if it helps get you started, good. I'm not afraid of simplifying a little bit in order to give people some understanding. That's my philosophy, because remember, I was completely genuine with this. I'm used to being out of my depth. And I think it's fine to have a little bit of a simplified primer. And if Wikipedia gets it a little bit wrong here and there, well, if that gives me some understanding or insight into something, I can grin and bear it.
As you said, it's about getting information from a range of sources, isn't it? So not simply not taking Wikipedia as gospel, but
yeah.
Yes.
And getting started, as long as you know that Wikipedia may not be 100% accurate and you need to look at other things, I think you're fine most of the time.
Yeah. There's a comment in the chat as well about not forgetting librarians for help in accessing and reading journals. They'd say they're a mine of information and nowhere to get good quality information and could save you a huge amount of time. So that's also a valuable tip, I think, to keep in mind, isn't it?
Yeah, I remember being in the British Library once, and I was looking for an article in a journal called Biochemistry. There are many journals called Biochemistry, and somehow by some magic, the librarian within seconds got exactly what I needed. Librarians are some of the cleverest people out there, in my opinion. They just know everything. They have the longest memories of anyone that I know apart from cab drivers. Librarians are absolutely fantastic, great people, mine of knowledge.
Use our librarians. Nigel Crawford has raised his hand. Would you like to ask a question, Nigel? We can't hear you, I'm afraid.
Is he muted?
Oh, he's just muted himself now. Try again, Nigel. I'm really sorry, we can't hear you. Can you type it in the chat function? Bated breath, waiting for the question. While we're waiting, I wanted to read you another comment that we've had come in, which is about some teaching that one of our viewers has been doing. He says, I've had A-level students this year who've been set coursework tasks to review a research paper, sometimes of their own choice, and they've been asked to source it. And they are asked to discuss the validity and reliability of the conclusions and identify any weaknesses. So it's important to recognise that awareness is changing, and from the bottom up, age-wise, which I think is something that we can all take heart in, isn't it?
Good. Good, I'm really pleased to hear that. It didn't used to be possible. So before the internet, this sort of thing was so much harder. And now you'll find journals going back hundreds of years. That journal that I referred to, the Philosophical Transactions of the Royal Society, that first edition from 1665, you'll find online and for free, I think. So, you know, journals are much more accessible nowadays.
Just look, sorry, excuse me while I scroll through the other comments. Just say, from Douglas, I think it may be good for every researcher to apply the same principles that are applied to clinical consent. They should be able to get the public to explain in their own words what it is that the researcher is trying to prove. I think we'd all agree with that, wouldn't we? Nigel, I'm sorry, we still can't hear you. I don't know what the issue is. You're definitely unmuted at our end.
Maybe you could type the question.
Yeah, can you see the chat function, Nigel? from the list of options at the bottom of your screen. Little speech bubble. And while we're still struggling, I'd like to draw your attention. We'd really love to hear your feedback at this. And Claire has posted the link to a survey. It's very short, I promise you, which will be online. It is online now, in fact, so you can leave us your feedback. And all of your feedback we take into account, and we'll, when we consider our, our next webinars in the future. So we'd love your suggestions for topics and also your comments about today. Because very importantly, I need to tell you, Thomas, there are huge thanks. Many people saying thank you for the presentation.
Thank you for listening to me. I'm very happy for my slides with all the web links. I've deliberately put them together in that way to be circulated to any of you here. Thank you very much for taking the time and patience to listen to me.
It's been really fascinating. Thank you. And oh, Douglas, your hand was up. Did you want to speak?
Yeah, I was gonna, can you hear me?
Yes.
Yes, I can.
Yeah, great, wonderful. Yeah, I was going to say it was fascinating, but I think that we still have got quite a long way to go, and the reason I say that is because I think that as we move towards, so for instance, the vaccine for COVID-19, I think a lot of people will want to be able to make their own decisions and also make those decisions based on evidence that they can hear and understand. And I think that we're quite far from that at the moment. You know, as I say in the chat. At the moment, you know, the best peer-reviewed journal for the public is the Daily Mail, and that can't go on. And the reason why the Daily Mail is so well read is because actually it's written for the public. And I think that we do need to get into a whole system of trying to get people to make their research much more accessible, because some of that research is fantastic. It really is fantastic, well worth understanding, but we just don't try very hard to get the public to understand it.
I wholeheartedly agree with that. One thing that I'd mention is that on the NHS website, there's a section called NHS behind the headlines, and they produce really good they can really go into the science behind various headlines. I very much hope that they'll do something around the vaccine. I agree with you. I think we need to do everything that we can to make everything transparent and understandable to encourage uptake on a personal basis. Personally, I'm very for vaccine, but we want people to make their own decisions.
I think it's simple. We need to find better ways of making people aware that these sources of reliable information exist, don't they? It's all very well them, you know, we know about them, we know, and we can share it through these webinars, but finding a way to promote things like behind the headlines is really important. So spread the word.